Dr. Chia Shi Lu.
Mr. Speaker, I join other honourable members in expressing my support for the motion of thanks to the President for her address. To heed the President's call for us to forge a cohesive, caring and inclusive society, and particularly for our seniors, I would like to take this opportunity to raise 3 ideas about how we can smoothen some of the bumps and ripples in our healthcare landscape, to remove some of the friction where it is not needed, so as to promote more equal access to medical services. As my following comments do concern some adjustments of a fiscal nature, I'd like to declare my interest currently as a medical practitioner in a public healthcare institution. Now, first let me talk about Medisave. I would like to propose that we think once again and hard about further liberalizing the use of Medisave in a bolder and more decisive manner. Over the years, I and many others within this House have called for the liberalization of Medisave use, in particular for outpatient treatments. The Ministry of Health has certainly done very much in this regard by introducing and expanding many schemes, such as the Chronic Disease Management Program and more recently the Flexi Medisave program. They have also allowed greater use of Medisave for medical scans and so on. These measures are effective, but can be complex and at times may be too restrictive. The concern, of course, and it's something we all appreciate, is that too loose a policy on Medisave withdrawals could lead to an earlier depletion of our accounts, leaving nothing for us to rely on in later years when medical needs and expenses could be greater. However, I'm not sure that this worry is always necessarily well-founded. If you look at the statistics over the past few years, the mean Medisave account balances among Singaporeans have been increasing steadily, and a significant number do pass on with remaining balances of a fairly appreciable amount in their accounts. For some Singaporeans with multiple chronic illnesses or whose illnesses cannot be adequately controlled by medicines on the standard medication list, the out-of-pocket cash outlay for medical treatment, even at polyclinics and with PG benefits, can still remain quite high due to the utilization limits for Medisave. I would like to propose that Singaporeans who are above the retirement age be allowed to pay for a greater amount of their subsidized outpatient treatment costs at government clinics using their Medisave, perhaps as a start up to 80% of the expenses, and this can be adjusted as needs arise. And this should be subject to a doctor's certification. Now, such a move would not change matters for the majority of elderly patients for whom the chronic disease withdrawal limit of $400 and a Flexi Medisave limit of $200 would already more than adequately cover 80% of their annual outpatient treatment costs. But it could make a meaningful difference to the elderly with multiple or less common conditions requiring more specialized and expensive medications, or who require more medical investigations to better manage their conditions. Presently, for a patient who has exceeded his Medisave claims limits and who finds it challenging to pay the remainder in cash, he or she has a few options. One, he can appeal to the ministry to withdraw more from his Medisave. Two, he can apply to the Medication Assistance Fund and other welfare schemes. Or third, he or she could just simply choose to forego treatment or to forego some of the treatment in excess of what he is willing to pay for in cash. Allowing for greater Medisave withdrawal in these cases can help a patient avoid trying the welfare route, which ultimately adds to public expenditures, and also encourage compliance with treatment. If the patient follows on with treatment, then the future consequences of his condition, if left improperly managed or suboptimally managed, would be less, and the eventual costs to both the patient and society would ultimately be lower. I am of the opinion that further loosening of the Medisave purse strings would not lead to over-servicing or overconsumption. I would like to remark that these are the patients, we are talking about patients here who are adhering to treatment protocols that a public service doctor has deemed to be necessary and who has to certify that it is necessary without a cheaper alternative. There also remains an element of co-payment. And our treatment management schemes have been strengthened over the past few years. For example, agencies such as ACE, the Agency for Care Effectiveness, are now putting in place guidelines about what constitutes effective treatment and what is not. The introduction of the PG package, for instance, a few years ago, with very generous benefits, has also not led to worrying levels of overconsumption or over-servicing within the public healthcare system thus far. Second, I think it is just and right that the government has been absorbing the GST charged to subsidized medical services in public healthcare institutions for many years now, at considerable cost to the ministry. We are also trying, of course, to shift our model of care beyond the hospital and back to the community by strengthening our primary healthcare networks. Now, while the majority of hospital care is now provided for by public hospitals, the majority of Singaporeans still choose to visit their family doctors or general practitioners rather than polyclinics for their primary care needs. The CHAS and PG schemes have helped to deliver government subsidies to our family doctors and have strengthened general practice through the reduction of market distortions due to larger subsidies received by polyclinic patients. I believe we can do even more in this field or in this regard, and I would like to consider, or for us to think about, potentially exempting primary healthcare services from GST. Now, this would be a major deviation from our GST framework, which favors a flat system with later reliefs or government transfers. Philosophically, I realize this is a slippery slope, but in practical terms, it would be very much in keeping with the intent of current policy that already absorbs GST from subsidized healthcare services. Removing this consumption tax from all primary healthcare services could nudge more patients back to family doctors or general practitioners for care and encourage compliance with treatment and follow-up by reducing costs. I wish to emphasize that this suggestion refers only to primary care services and not for hospital or other types of medical care. I also appreciate that at present most solo practices, for instance, are not GST registered. But with the emergence of more group practices and with the increasing cost of healthcare, the number of healthcare providers that need to pay GST may increase in the future. What constitutes a provider of primary healthcare services can be defined and can be licensed, and this is also an issue that can perhaps be addressed when we debate the Healthcare Services Act later this year. I appreciate that there will be issues with the implementation of such a scheme, but I certainly believe that it merits consideration. Lastly, a little bit about insurance coverage. The introduction of Medisave Life, which provides universal health insurance or coverage for Singaporeans, marked a proud day for Singapore's healthcare system, exemplifying the caring, inclusive society that President Halimah spoke of. Although a hallmark of Medisave Life is that no one is excluded, including those with pre-existing conditions, like virtually all medical insurance systems, there remain some gaps. For instance, I'd like to draw your attention to two areas. First, with regard to pregnancy-related complications, and second, about conditions related to mental health. These are still not fully covered under Medisave Life when hospitalization is required. I believe that we should consider expanding coverage to these conditions as well. We have been strongly encouraging parenthood, and it would serve as a greater assurance to would-be parents that the mother's medical care can be covered in the uncommon instances of complications related to the pregnancy. We have also been slowly but significantly expanding our support for mental health, even as the disease burden inches up within our community. I hope that when Medisave Life is reviewed, consideration can be given to expand coverage to some, if not all, mental health-related hospitalizations. We have come a long way. We have passed 50 years successfully as an independent nation, and we are now moving on to 200 years after the founding of Singapore. We now have a new generation of Singaporeans and a new generation of Singaporean leaders that will steer us towards SG 100. It is my hope that our healthcare system remains future-ready and also friction-free where it counts. Thank you, and I support the motion.